Hello, my name is Tara Holcomb, and I will be presenting on cognitive behavioral marriage therapy. Just a quick history on cognitive behavioral therapy. CBT was developed by Aaron Beck as a treatment primarily for depression. Over time, it has been adapted to address a variety of issues, including anxiety, chronic health conditions, grief, and insomnia. CBT aims to challenge unhealthy thought patterns, facilitating the development of more positive emotional responses and behaviors. Typically, it is conducted over a short term of about 8 to 12 sessions. It is also goal oriented and skills based approach. This adaptability makes CBT an effective method for addressing various mental health concerns and maladaptive thought processes. Additionally, CBT can be beneficial for couples experiencing dissatisfaction in their relationships or facing challenges that may complicate their marriage or partnership. Yazar and Tolan highlight that the key distinction between marriage therapy and individual therapy lies in the collaborative approach of couples working together towards a common goal, rather than isolating issues attributed to just one partner. Cognitive behavioral couples therapy and cognitive behavioral marriage therapy are so closely related that I will refer to them collectively as CBMT from here on. CBMT emphasizes the thoughts and behaviors that affect a couple's overall happiness or distress. The therapy aims to identify and alter detrimental behaviors that contribute to dissatisfaction within the marriage. It operates on the fundamental principle that thoughts, emotions, and behaviors are all interlinked. For instance, in a marriage or partnership, both individuals harbor automatic thoughts about themselves and each other, which then can instigate negative behaviors that perpetuate conflict or withdrawal. CBMT has been shown to enhance marital satisfaction, increase intimacy, foster or strengthen healthy communication, and reduce conflict. Here are some common contributors to challenges in marriages: transitioning into parenthood, insufficient problem solving skills, poor communication abilities, differing expectations between partners, economic hardships, sexual difficulties, and relationships with each other's families. Yazar and Tolan emphasize that conflicts in marriage often stem from couples' distorted perceptions, generalized thinking, and illogical assumptions. They suggest that employing CBMT to reframe these thoughts can lead to a more fulfilling relationship. Additionally, the authors explore various cognitive patterns that can lead to conflict, as well as specific mental health issues one partner may experience, including depression, post traumatic stress disorder, OCD, and substance abuse. They explain how couples can engage in CBMT to provide mutual support. According to Epstein and Zeg, being in a relationship can either enhance a couple's well being, shielding them from life stressors, or it can become a source of stress that adversely affects an individual's well being. They identify five types of cognitions that each partner in a relationship may experience. These are selective attention, and this occurs when one partner focuses on a specific aspect of an event while disregarding other important details. Attributions, these are assumptions made about the factors influencing either one's own or the partner's behavior. Expectations refer to predictions about the likelihood of a particular event occurring. And then assumptions and standards are deeply rooted thoughts or beliefs that have been molded over the lifetime of the person. The assumptions represent deeply ingrained beliefs about the fundamental traits of people and relationships. For instance, a person whose father mistreated their mother may believe that all men are capable of such behavior. And then standards, these are the ideas or beliefs that define an individual or their relationship. An example would be a wife who believes her husband should automatically be the primary breadwinner, allowing her to be a full-time homemaker. CBMT therapists are equipped to help couples recognize and modify these unhealthy cognitions, fostering mutual growth and benefit within the relationship. CBMT can be utilized not only to navigate marital discourse and address challenges stemming from unhealthy thought patterns, but it also assists clients in collaboratively managing stress related to individual psychological disorders. Research indicates that CBMT often outperforms individual therapy for a variety of mental health and physical disorders. According to Beach and Leary, CBMT has proven to alleviate symptoms of depression and relationship distress more effectively than individual therapy alone. A study by McDonnell et al. Found that couples in which one partner had PTSD and participated in CBMT experienced improvements in all PTSD symptom clusters, trauma related beliefs, and feelings of guilt, in contrast to a waitlist control group. Additionally, Abrimowitz et al. Developed a specific CBMT for couples dealing with OCD. The results revealed a significant reduction in OCD symptoms, with these improvements remaining stable at both 6 and 12-month follow-up assessments. Furthermore, CBMT has shown greater effectiveness for individuals with substance abuse disorders compared to individual therapy. Research suggests that those with a supportive partner typically enjoy more days of abstinence, experience fewer substance related issues, and report a higher relationship satisfaction for both individuals involved. In all these scenarios, the relationship serves as a vital source of support for the individual facing the disorder. Cognitive behavioral marriage therapy offers several strengths that contribute to its widespread use. One of the main advantages of this approach is its structured, goal focused framework, which enables couples to identify specific problematic thoughts, feelings, behaviors that contribute to relationship issues. The model emphasizes techniques like cognitive restructuring and communication skills training, equipping partners with practical tools that they can use beyond therapy sessions. And this approach also promotes increased self-awareness and helps maintain skills over the long term. CBMT is also very flexible and can be adapted to help with various issues such as infidelity, sexual dissatisfaction, or emotional disconnection. Its evidence based backing and structure, effective interventions make it attractive for both clinicians and clients. There are several limitations that have been observed regarding CBMT. Critics argue that its emphasis on cognition and behavior may overlook the deeper emotional or attachment issues present in a relationship. Couples also may suppress their emotions to focus on thoughts and cognition processes. Some couples also might struggle to adapt to such a structured framework, particularly if they have unresolved issues, avoid expressing emotions, or face cultural differences that affect their communication style. In summary, while CBMT is a versatile and effective intervention, its effectiveness often hinges on the therapist's ability to balance structure with the unique needs of each couple. When working with couples, a therapist can leverage their background in CBT in various effective ways. A social worker beginning with couples should focus on establishing rapport and recognizing each individual's communication style first. Consider the following questions. Does one partner or the other dominate the conversation or interrupt the other? Is one partner more reserved? Are both partners committed to attending the sessions? Or do they both perceive challenges in their relationship? This understanding can aid the social worker in formulating an appropriate treatment plan. The social worker might also employ psychoeducation to introduce the concept of the cognitive triangle, helping the couple grasp that automatic thoughts shaped by personal schemas or core beliefs can lead to dysfunctional conclusions or assumptions. And these thoughts impact feelings and behaviors, and they may not always be accurate. Therapists can teach effective communication and listening skills to foster a safe environment where each partner feels comfortable sharing their genuine feelings. They can assist the couple in recognizing negative thought patterns and encourage them to reframe these thoughts. By learning to analyze and adjust their thoughts to be more adaptive, couples can strengthen their marriage and cultivate a positive partnership. It's crucial for the therapist to maintain structure and assign homework or action plans for the couple to work on between sessions. Techniques for homework may include role playing, turn taking, journaling, keeping thought records, and establishing a practice of celebrating small wins. Some sessions may involve the couple reenacting real or hypothetical situations from their relationship to explore each other's feelings at that moment. This practice can shed light on the automatic thoughts that may have led to dysfunctional behaviors, fostering a greater understanding between the two people. The therapist might also encourage one partner to discuss a specific issue while the other proposes solutions, guiding them through negotiations step by step. Through Socratic questioning, the therapist can help uncover the core beliefs behind automatic thoughts and what may be causing marital difficulties. This approach allows for open discussion as partners often assume the other understands their thoughts and frustrations when in reality they do not. The social worker can suggest action plans such as thought records or journaling to aid in self reflection. These tools can be particularly beneficial when a couple is experiencing miscommunication and feelings of disconnection. Each partner could complete a thought record before the next session, followed by an open dialogue about their actual thoughts during or after disagreements. This exercise can help identify core beliefs influencing their behavior, which may contribute to ongoing conflicts. Most of the articles on this topic emphasize that the importance of action plans encourage couples to foster positive interactions. This might involve spending quality time on enjoyable activities or engaging in homework that is low stakes. So, by achieving these small goals at aiming at enhancing their marriage, couples can experience little victories that motivate them to strive for greater satisfaction as a partnership. So, in conclusion, cognitive behavioral marriage therapy is a structured, evidence based approach that helps couples understand their own and their partner's thoughts rooted in core beliefs and assists them in restructuring and modifying those thoughts and behaviors, thereby reducing conflict in their marriage. It is flexible and can be tailored to address specific marital issues that lead to emotional disengagement. It also encourages couples to attain small victories by accomplishing their set couple goals. CBMT creates a roadmap for couples to build a healthier, more resilient relationship while providing the therapist with a framework to support couples within a guided treatment approach. And here are my references. Thank you so much.